Hi, I'm Dr. Jordan Tace, and welcome to Veritalks Spotlight. Today's spotlight is on emergency medicine and smoke inhalation. We're going to discuss how smoke inhalation causes damage and how it should be treated. Smoke inhalation causes injury in three specific ways: tissue hypoxia, thermal injury, and direct pulmonary injury. The smoke can contain various chemicals, including carbon monoxide, cyanide, chlorine gas, and soot particles. Without treatment, smoke inhalation can kill a patient well before burn injuries. The upper airways are the most common part of the respiratory tree to be affected by thermal injury, as they act as a heat sink and absorb the majority of the heat that the patient inhales. Edema and inflammation can be progressive over the first 24 hours, even resulting in upper airway obstruction. Because of this possibility, you should be prepared to perform an emergency tracheostomy. Damage to the lower respiratory tract depends on the types and amounts of gases inspired. Damage to the pulmonary endothelium and the mucociliary apparatus decrease their ability to remove particulates from the lungs, resulting in a secondary bacterial pneumonitis. Carbon monoxide is the most concerning toxin associated with smoke inhalation, but is often overlooked due to the difficulty in making a diagnosis. Carbon monoxide binds to hemoglobin with an affinity that is 200 times that of oxygen, and fatalities can result when at least 40% of the hemoglobin is bound to carbon monoxide. And unfortunately, most of our diagnostic tests are normal. These tests include chest radiographs, partial pressure of arterial oxygen on blood gas, and pulse oximetry. By far, the most important treatment for smoke inhalation is oxygen supplementation. It should be provided to all patients, regardless of clinical signs, both at the scene and in the hospital. It can be administered in a variety of means, depending on what is appropriate for your hospital. IV fluids should be administered, but the amount given is completely case dependent. Ideally, you should provide enough fluids to optimize perfusion, but not so much that you exacerbate pulmonary edema. Analgesia is essential for these patients, especially since many of them will present with comorbidities, such as burn wounds. Corticosteroids should be reserved for severe cases of upper respiratory swelling and edema, as they will have little effect on the lower airway. Prophylactic antibiotics are not typically recommended. If you feel that you must give antibiotics in the interim, select combinations that are extremely broad spectrum. For example, a combination of ampicillin with Baytril or cefazolin with amikacin. It is imperative that you obtain a culture and sensitivity. Bacterial resistance can mean the difference between life and death for these patients. Finally, always stain the eyes and check for corneal damage, as corneal ulcers are quite common with thermal damage. If untreated, smoke inhalation can be fatal. The most important treatment is oxygen supplementation, both at the scene and at the hospital. Thanks for joining us. For more veterinary resources, visit VeritasDVM.com, and thanks again for watching today's Veritas Spotlight.